I got to speak with a doctor and nurse from St. Francis Hospital and a nurse from UConn Health. Now, there is no quit in any of them. In fact, there's still hope and optimism, despite a 21-month-long roller coaster of fear, frustration, and exhaustion.
We got it. I used to be able to pick up extra hours and help out. I can't do that anymore. I am literally exhausted with my 3 12-hour shifts.
And you care for these patients day in and day out, month after month, the same patients, and you feel like they never get better.
A 30-year-old brand new mom who has an infant and then a toddler.
And you lose another one and another one.
And it's because of COVID and not vaccinated.
And that builds up over time, and you carry that with you.
Because if you think about it too much, I mean, you'll be in tears.
All right. Was she alert and oriented when she came in?
Yeah, she was alert and oriented, speaking in like 2-word sentences.
The pandemic isn't over, but for Dr. Jen Martin, the days are calmer.
I'm well. It's been a long, almost 2 years now, I guess.
Part of those 2 years were spent living in her driveway after a COVID scare.
One of our children is immunosuppressed, and we didn't know what to expect. And I talked to her doctor one day, and I said, what should I do? Should I send her to my parents in Massachusetts? And that was sort of our plan. And then one night we said, why don't we get an RV? And we put an RV in our front lawn, or on our driveway for 6 weeks. And he and I stayed in an RV. My parents moved into my house and took care of our children.
In the earliest part of the pandemic, it was hard even to take care of herself.
In March and April, I remember through like Nextdoor or Facebook, putting advertisements and driving to like random neighborhoods near where I live, picking up PPE that people bought from overseas and donated.
And that shortage made for extra stress for St. Francis nurse Jasmine Holman and Kelly DeJoseph, a nurse at UConn Health.
Originally, when the first round of COVID hit, we were a closed COVID unit. So we would enter work, put on a full suit, a mask or 2 masks, a visor, a head covering, multiple pairs of gloves, and you would enter.
A gown in every single time you enter a room. I have glasses, so all of the PPE for like the eye protection, my glasses are constantly foggy.
And if you think a mask is stifling, try 2 masks, plus this.
What you're describing with the tube in the back, that's called a PAPR. It's essentially a self-contained respiratory device that filters out the air.
And you couldn't take any of that off until you could take a break. So you would go 4 or 5 hours at a time without being able to take a drink, use the restroom, scratch your nose if you wanted to.
Yeah, what was her blood pressure?
And experiencing that with a patient, through 3 layers of PPE, it takes away from that component of what, trying to understand how they're feeling and emote what you're feeling and how you feel for them.
Yeah, no, I know. Yeah. They have those.
So we got the tube down, right? Or they...
As the months go on, the victims on average are fewer, but also younger and largely unvaccinated.
How many of them wind up having that come to God moment that, oh my God, I calculated wrong,
All of them, every single one.
There's been a lot of nurses, especially during COVID, during the peak of COVID, and even now, who are witness to like very traumatic deaths.
And we did allow Zoom visits with families and video visits and so forth, but that doesn't meet up with holding a hand or giving someone a hug or seeing that close person. And they had been with us for months at this point, or extended stays, 6, 7, 8 weeks, and hadn't seen a family member in that whole time, and then died alone.
How many times did you have to go through that?
10, 15, 20.
You want to go get that for transport?
Both Jasmine and Kelly said their employers did their best to keep nurses safe and fresh, but they also found strength in their coworkers.
So if there's been like a traumatic incident or something that's been difficult for us, we'll try to schedule something outside of work.
We go on walks together, we do things together, and we say, without each other and having them to experience this kind of event together, I don't know if anybody would have gotten through it.
But they are getting through it, even though some coworkers burned out and left nursing. And now they said brighter days are ahead.
I think that there's finally a light at the end of the tunnel now that the vaccine has been widely distributed.
I hope that maybe those people find their way back and recognize that it's caring for our patients. That's why everybody went to nursing school, medical school, PA school.
One of the biggest things that this pandemic has also highlighted is the resiliency in nursing as a profession.
I can tell that that spirit is coming back. We're hiring new employees. They're excited to work here. People, they want to come to work. You know, we want to help people. We want to do our jobs.
I'm Tim Lammers, Fox 61 News.